I'm Wendy Wills. I work at the University of Hertfordshire, where I'm Director of the Centre for Research in Public Health and Community Care, and I lead the ARC, that's the Applied Research Collaboration for the East of England Prevention and Early Detection in Health and Social Care theme. We're a cross-cutting theme in the ARC, so we cross-cut with all the other work that's going on, but we have a particular interest in research that might explore what might prevent populations from becoming ill in the first place, and so that they don't experience disease or deterioration in long-term conditions or developing new conditions. We've got particular subgroup interests and expertise right across the East of England in food and nutrition. We have a really sort of buoyant group that covers malnutrition, food security, obesity, for example. We're also really interested in looking more and studying sort of prevention and early detection of cancer, particularly amongst groups where take-up of screening invitations, for example, might not be as great as we'd like it to be. Certain black and minority ethnic groups, for example, and looking at whether men and women, etc., right across the region are taking up those services when they're offered to them. And we're really interested in carers' health, because we know this comes up time and again when we talk to communities and also talk to our colleagues across the region working on other themes, that if we don't look after our carers and really do research to understand what might support them, then of course then not only is their own health going to deteriorate, but they also can't care for the people that they're caring for, sort of formally or informally. So it's really important that we pay attention to that group. So we've been really busy since the spring in 2020 because of COVID. We wanted to design a project looking at dietary inequalities across the region. So really looking at the challenges that people were facing at accessing food, and whether that's a household with a family and children or an older person living alone, for example, and also looking at the organisations that support people to get food across the region. And that's had to change quite rapidly. There were well-established systems for people getting food, but local authorities had to get more involved in that. So we've been busy interviewing people. We've published an interim report before Christmas, but the work's ongoing because things are changing all the time. New challenges, new difficulties, the longer that these lockdowns go on, and we hear such stories of sort of hardship and difficulty from schools, from older people, from people who can't get out and shop. So we're really keen that that project will keep going, because there's a lot of lessons that we can learn from that and sort of lead the way in the East of England, spreading the word about the lessons learnt. We ran a community photography competition a few months ago. We asked people living in the East of England to take pictures of places that meant something to them. We awarded some fabulous prizes to a small number of winners, but we were so impressed by all of the sort of over 60 entries that we've turned that into a fabulous online exhibition. So everybody can click on a link that will be in our newsletter, and you can have a look at all these wonderful pictures from right across the East of England. I just think it's an absolute joy to see it through other people's eyes, what their special places and what they mean to them. So do have a look at that. We have an ongoing project trying to ask people, what does prevention mean to them? It means different things to different people. What is it people are interested in us doing research on? What do they want us to prevent? And so we get lovely quotes from people as we go across the region remotely, now that we can't do it in person, asking them what it is that they want us to do research on. So that will be an ongoing project. And we're just planning another public webinar that anyone can log on, because it will be online, which is the joy of working like this. But we're really thinking, what is it we need to prioritise? What do different people from across what we might call the system, whether that's a community group, an organisation, people within the NHS, Department of Health at national and local level, how can we prioritise prevention to get the most out of our ARC theme and make sure we're really doing some good in our region? So there's a lot going on, and a lot more that we can plan, despite the times that we're living in, really. We have to keep going and doing this important research.